Thank you guys so much for joining. My name is Sierra. I'm the CEO and founder of Elite Precision Consulting. Welcome to Global Healthcare Summit 3.0. As the owner of Elite Precision Consulting, we focus on global facilitation, meaning how you can work with teams around the world to accomplish your goals, your missions. And we wanted to have this summit to further highlight the great companies and talents in different countries around the world. Some of these countries we have done business in pretty extensively. Others, it's new to us. And we also wanted to learn more about what's happening in their region, what opportunities are there, also how they can enhance their global collaboration, what partners are they needing to bring on board to further their mission, and maybe you as an attendee, maybe you have that solution. And so we're here to talk healthcare related topics. Although our company handles multiple sectors, we really love healthcare. We've been in healthcare for 17 years and just wanted to further amplify that. Dr. Holder March, which I would love to introduce. We just have a few minutes, but I would love for her to just share a few things about herself, the work that she's doing. Great way to kind of end our session, our 2-day event. So I'm going to give her the mic and kind of the stage for her to share a little bit about herself. Thank you so much, Dr. Hodemarch, for being able to join us on our platform today.
Hi, thank you. Hi to everyone. And I do apologize, but a major incident happened and I had to deal with that. And I do apologize. This is such a great event and I look forward to 2024 event. And I think it's wonderful, the collaboration. I am a background is in healthcare. It's in healthcare management. It's in leadership. I'm a well-known ambassador for data and antimicrobial and all sorts, and I'm easy to find on the Google platform. And I think one of the things I was, listening and hearing what you said, Sierra, it's really important about addressing not only the impact of healthcare issues within a country, but look at on a much more global market, and that is what technology is doing to empower patients to ask the right questions. So far, most of the technology is very much whereby the data within that, the whole concept of it is really that the offerings is to you as a patient, but all of the data, the control, the management is held by different companies elsewhere. So you buy it, you purchase it, or you get it from your hospital provider. What I would like to see is a much more collaborative effort, because even if someone is in a village, if someone is in a most rural area, they do have a cell phone. And I think it's time as healthcare professionals, healthcare suppliers, healthcare entrepreneurs, healthcare advocates, that we start having some sort of two things: the technology that empower patients to ask the right questions and get the response, technology that tells the patient where their data is held, technology whereby there is training on the technology that patients use. Because many people have an example, some smartwatches, I wouldn't call names of them, and they wear it, but they don't understand where that data go to. They don't know what to do if, for example, it says your heart rate is this or that. For the academic and those who are healthcare professionals, oh my God, it's this, I need to do this. But for most people, there's no training around that. And so therefore, I do hope in 2023, as we advance to much more extremism in regards to technology and platforms, that we will remember that they're the elderly who don't understand a lot of basic technology. And there are other vulnerable people who don't understand technology, but they are also participants of the technology world. And there will be some collaborative world right across the world for people to get together and say, hey, we need to actually work and be more advocating for the patients. And I look forward to that, really. And we can do it. And I look forward to people developing the technology to do that, that will be able to tie in with the current technology, to work as a supportive technology where people can put in the information elsewhere and get real responses to say, you need to go to the doctor, this is, in very user-friendly, simple language, and not only in English, please, in various languages so that people can understand it. And I really am super excited. And if there is any opportunity for us to work together in advancing this type of technology, I would look forward to actually being part of that as a small, tiny investor. So I certainly will. Any questions for me on that? That's fine.
Yes. I think it's great. We've talked so much about technology these last 2 days, and I love the part, saying not just in English, like it needs to be adaptable and accessible for everyone,
Yes.
for everyone, user-friendly. And like you said, especially for the elderly, everyone doesn't have the same tech skills. And so having a very smart piece of technology, I know things say that they're smart, but they're not very smart. They're smart to someone who's advanced. I'm like, this technology is not as smart as it says it is. But, having good, smart, effective technology, I think is you're spot on with that. And, and helping to further advance, wellness, the healthcare system with the technology. And this is kind of what I was even asking Mr. Dang and some other of our speakers, do we need more technology? Do we need less? Do we just need better technology? I mean, I feel like the world is so technology driven, but yet is it even effective? Is it actually solving the problem and bringing the solutions to what we need them to bring solutions to? And it's Martin had spoke yesterday. I think his statement was, everybody talks about AI, and he's like, most AI is not even really AI. It's just like we're throwing around these words, and it's not really doing what
I agree with him. I agree with him 100%. And I just want to go back to what you just said there. There is another fold to this, is that, for example, I'm not going to call the social media platforms that have millions and millions of viewers. And what I'm hoping to see, that these social media platforms will start categorizing, so that when you click on a particular social media where there's millions of it, you can click in and go, I want to see things about health. I want to see things about elderly. I want to see things about funny jokes. I want to see things about whatever, women, whatever, men. And so therefore you can actually, instead of just all these videos being streamed down, you can actually pull in the ones that is about health. And maybe it's a proposal we could write to them for, because a lot of people go into those, and it would be great. Although there's a search button, it'd be great if you can search and find information groups that can help a lot of people. And that's a great avenue for people like yourself and Rudang, I hope I'm saying your name right, and Suraj Kumar, people like that, to actually get on there to actually speak to the majority about self-care, health, well-being, and also the power of technology and how they can utilize it in their family life, in their life, because people have children, and the children are better at the technology than themselves, and they are just sitting there going, wow, but it would be great to actually bring them to a level where, in regards to their health, eating, everything about their health from head to toe, it would be a great mobilizer. It would be a great advancement for the benefit of humanity when we start empowering all of us to actually understand about our health in a different way, rather than waiting for public education. We actually working alongside technology where we see it right at home.